Joining us today are Jason Alexander from the Capacity for Change and Your Way Home, as well as Kaylee Silver from the Montgomery County Department of Human Services, Office of Housing and Community Development, and Kathy Crablin from Valley Youth House. Jason Alexander is a principal and co-founder of Capacity for Change, LLC, a consulting firm that helps public, philanthropic, and nonprofit organizations achieve greater impact through innovative strategy and partnership design. Since 2013, Jason has served as the senior advisor to Your Way Home, the coordinated housing crisis response system in Montgomery County, Pennsylvania, that recently received a HUD Secretary's Award for Public Philanthropic Partnerships. He also works with communities throughout Pennsylvania to establish coordinated entry for homeless services and embrace housing-first approaches to ending homelessness. Jason has a master's degree in public policy from the University of Delaware and was the first recipient of the Marvin S. Gilman National Housing Endowment Scholarship in U.S. Housing and Urban Policy. Kaylee Silver is the Your Way Home Program Manager in the Montgomery County Department of Human Services Office of Housing and Community Development. She has a Master's of Social Services from the Bryn Mawr Graduate School of Social Work and Social Research. Prior to working directly in the field of housing, she worked with families in the behavioral health system in the field of clinical mental health services. She has received the Pennsylvania Society for Clinical Social Work Award for Clinical Excellence, was a leader for the Montgomery County Trauma Enforced Systems of Care Initiative, and has over 8 years experience in the nonprofit sector. Kathy Crablin has worked in the Development Department of Valley Youth House for the last 12 years. Her responsibilities include developing applications for funding to support the agency's $22 million budget with programs in 12 eastern and central Pennsylvania counties. She is also actively involved in building coalitions in the Lehigh Valley to advance services to individuals experiencing homelessness and transition-age youth preparing for independence. As an active member of the local Continuum of Care, Kathy co-chaired the Lehigh Valley Regional Homeless Advisory Board until 2015 and was a member of the COC Governing Board, which affected the restructuring of the Balance of State COC in 2014. Kathy is a graduate of St. Lawrence University and has worked in the nonprofit sector for 25 years, serving disadvantaged children and youth. I want to thank Jason, Kaylee, and Kathy again. And now I'm going to turn the presentation over to Jason to begin.
Thank you, Stephanie, and thank you, everyone, for giving us your time this afternoon. We're going to present on diversion and coordinated entry for homeless services. And the reason I selected this photograph for the cover slide is because this is the precise only angle from which you can look at this wall of stone and see the straight lines that move down the wall. I thought it would be a good metaphor for the overarching concept of coordinated entry, which is to provide a clear line for people experiencing homelessness to identify, find, and receive the housing and services they need to exit from homelessness to permanent housing with stability and support and be successful. What we are going to talk about today is really two strategies that are intertwined. They're part of a housing-first approach to ending homelessness. They are diversion and coordinated entry for homeless services. I've been privileged to work with both of the speakers today, one on a single county coordinated entry effort, which you will learn about, Your Way Home Montgomery County, as well as a newer effort in the Eastern Pennsylvania Balance of State Continuum of Care, which is the 33-county region in Eastern Pennsylvania, and we'll talk about what we have been doing there to plan for and roll out coordinated entry when in a multi-county region. Along the way, all three of us will present some examples of innovations in coord entry, including diversion from shelter as a coordinated entry strategy. And in midpoint of the program, I will present to you some of the latest HUD rules, which will have an impact on every single community in the nation, every coordinated entry system which either exists or will exist in the Commonwealth, and every continuum of care throughout the Commonwealth. And again, I'd like to thank you all, and we are going to reserve a significant amount of time, the last 15 to 20 minutes of this hour, for your questions. So I just wanted to provide a little bit of information up front about what is coordinated entry for housing and homeless services and what makes it different. And start with this iconic graphic, which you may have seen before, which was generated by Los Angeles and the Homes for Good initiative. It's probably the best single metaphor for what makes coordinated entry systems different. In many communities where there is uncoordinated entry into service, regardless of the passion, the skill, and the work of many, many great service providers in every community, when you are in a moment of crisis as a family, an individual, a youth, a veteran, a senior, a person with a disability, a person experiencing chronic or any other kind of homelessness, it can often feel like a maze of systems and services through which you must navigate yourself in order to access the help you need to exit from homelessness. It's a maze both for service providers and for consumers. And it is really simply through the fault, it's no fault of anyone. It's the fact that we have in this nation a series of complex human systems, including homeless services, housing, child welfare, mental and behavioral health, aging and adult services, physical health care, and others, which are opportunities for people to end their experience of homelessness. But navigating those systems at both the system level and the community level is simply a challenge because of their complexity. With coordinated entry systems in place, we can create a better experience and outcomes for consumers, service providers, and community partners by making it very clear how to enter the system, that no matter who you are, when you enter the system, you receive the same high-quality, coordinated services, and it allows the system to help consumers navigate to the right housing, the right services, and the right community supports they need to achieve permanent housing with stability. The three major components of coordinated entry are access, assessment, and referral. So accessing, and this, what this image on the left side of this screen I think brings to life is this is, again, another way of looking at the complexity of the housing and homeless system in any community, where often consumers and their service providers and advocates might feel like they're on an uncharted sea, a person alone on an island or a boat, and the bridge of coordinated entry will bring them into the system itself. But people come into the system with so many different kinds of challenges and hurdles, be they financial, be they health-related, be they housing-related, socially related, just so many reasons that come together to create the crisis of homelessness. And then moving into that system, there are additional challenges. What coordinated entry does is really attempt to streamline the access into the system for everyone. It introduce or build a coordinated assessment system so that everyone entering the system is assessed using best or promising practice tools, and that those tools prioritize based on vulnerability and severity of need, as well as tools that indicate what is the right intervention for any given family or individual. All this has to be done in a very complex funding environment, as I'm sure many of you know better than I. A complex funding and policy environment at the federal, state, local level, as well as community philanthropic support. And I don't think it will be a surprise to anyone to know that, to address the issue of homelessness in every community, we have fewer resources than we have need. And that's probably not likely to change in most communities over the next several years. So we need to look for solutions that make more effective use of limited funding and resources, and coordinated entry is one of those opportunities. The final thing to share about coordinated entry, whether you are planning for it or experiencing it, living in it, or support it, is that finally it's the systems change. And that systems change means we need to ask funders, service providers, consumers, and community partners to have a different experience of the system, because we're actually changing how the system works. Underlying the systems change of how people access, are assessed, and referred for services is a housing first philosophy, which really fits nicely with coordinated entry, because coordinated entry will make it possible to exit people from the system in a coordinated way as quickly and effectively as possible. This illustration on the left typically shows some of the things that change in a community when you implement coordinated entry systems. United Way of Greater Los Angeles says that without CES there are dead ends and closed doors. I'd prefer to say that there are silos and side doors. In other words, it's very hard sometimes to work across the systems and across communities, and without coordinated entry, there are many, many ways to get into the system, but they may not be the best ways that fit for a family, an individual, an experience, or a service provider. So coordinated entry provides a more seamless connection directly to the right housing and services. The second major systems change is that without a coordinated entry system, there can be many, many multiple intakes, applications, and wait lists for services based on what individual service providers or their funding partners require to enter the system. With a coordinated entry system in place, our ultimate goal is that consumers have to tell their story as few times as possible, that service providers have access to as much data about their consumers as possible, and that system leaders can look at the entire system and understand where there are concentrations of need, where the successes and challenges are, and where to seek out and invest in future opportunities that are going to better meet every community's specific need. So one survey that connects people to real-time housing is the ultimate goal of changing the system into a coordinated assessment system. The third major systems change is that many traditional systems work on a first-come, first-served basis. And with a coordinated entry system and the right tools in place, the entire system can work on a prioritization system. Every community can decide what its priorities are among its homeless populations, but ultimately the prioritization is meant to provide the best fit, create the best housing match, and make sure that the people who are most vulnerable, in need, and in danger are connected with shelter, housing, and services as quickly as possible. Finally, in a coordinated entry system, every organization that's part of the system is unleashed to do what it does best. And if your organization or the agencies you fund are best at actually delivering services that end homelessness, then you will be empowered to do that, while other organizations can concentrate their resources and expertise on that coordinated entry to bring people into the system. So no longer does everyone have to do everything, and often when you have to do everything, a lot of what you have to do is unfunded. So coordinated entry really concentrates the coordinated entry services into the appropriate set of providers that are going to just bring people into the system effectively. So it's very important to take away that coordinated entry will lead to a more effective system that better utilizes limited resources, but does create a major systems change. And a systems change, it always starts with some fear, trepidation, concern, questions, all the way through to excitement. And we want to build on that by making sure that every community has a thoughtful coordinated entry plan and a set of policies and procedures that support an effective coordinated entry system. One of the innovations that coordinated entry allows, that we'll hear about in just a moment from Your Way Home Montgomery County, is the introduction of system-wide diversion strategies. I'm just taking a definition from the National Alliance on Homelessness. Diversion from shelter is a strategy that prevents homelessness for people who are seeking shelter by helping them identify other arrangements and connect them with other services. Why diversion from shelter is important is that, first and foremost, it's an opportunity right when people come to the front door of the homeless system in your community. There are trained experts who can make sure that any family or individual can and needs to walk through that front door, because once you walk through the front door into the system, you become a consumer of the system, which has an impact on your life and has an impact on the system's funding and resources. By introducing proper diversion strategies at the front door, we can make sure that people who don't need to walk through that front door don't have to, which ultimately means there can be a reduction in the number of people who become literally homeless if they are right on the edge. It can reduce the demand for shelter beds, which in most communities are in short supply, and it can reduce wait lists for every kind of housing intervention program in any given community. Diversion does not mean that we're turning people away from help. Diversion means there are a set of people in every community for whom just a little bit of help up front can help them avoid a much longer experience within the homeless system itself. How those coordinated entry system strategies, policies, opportunities like diversion come to life is something that I'd like you to hear directly from people who are leaders within their systems, both single county COC and balance of state multi-county COC. So I'm going to turn over the rest of the presentation time first to Kaylee Silver to talk about Your Way Home Montgomery County. And then when Kaylee concludes, I'm just going to introduce a little more information from the U.S. Department of Housing and Urban Development. And then I'll transition to Kathy to talk about what is happening with court entry in Eastern Pennsylvania balance of state COC. So Kaylee, I'm going to turn it over to you.
Thank you, Jason, and thank you to the Housing Alliance for having me for this great learning opportunity. As Jason mentioned, my name is Kaylee Silver. I'm the Program Manager for Your Way Home, Montgomery County. I oversee the entire homeless and housing crisis response system within our county, including coordinated entry. So I work out of, as the Your Way Home Program Manager, I work out of the county's Health and Human Services Department within the Program Office of Housing and Community Development. And in January 2014, Your Way Home was established within this county office as the county's mission to end homelessness. In 2014, it was launched to help end homelessness, to make the experience of homelessness in Montgomery County rare, brief, and non-recurring. And as you can see, we've had quite an impact since 2014 by reducing homelessness by 34%, and just last year rapidly rehoused 459 people to permanent housing destinations. My objective today on this webinar is to help the audience members understand how one county, Montgomery County, has achieved these great outcomes due to its comprehensive coordinated entry system. So prior to 2014, all of the emergency shelters and housing crisis response providers in Montgomery County were working separately. And if a person was experiencing homelessness or housing crisis in the county, they had to call each separate emergency shelter. And we found that the people getting into emergency shelters tended to be people who either spoke the loudest, advocated for themselves the loudest, or already had connections and advocates for them to get them into services first. And we also found that well over half of people entering the homeless system and emergency shelters were actually coming from a house situation. And from there, what emergency shelter this person got into then determined what services you received, and also determined that you had to be sober to regain housing or employed, and there were a lot of rules and barriers associated with getting back on your feet. So in 2014, when Your Way Home was established, we established a coordinated entry process, and we aligned 7 Montgomery County emergency shelters to create one front door and a unified prioritization for services. And our unified prioritization is based on our value of serving the most vulnerable first, and that there are no preconditions to regaining housing, and a unified system so that our emergency resources and funds are pooled together. So what is our front door through Your Way Home and our homeless services? Our front door is the Your Way Home call center, which is operated out of a local 211 in New Jersey. And the basic function of the Your Way Home call center is so that anyone experiencing street homelessness in our county or at imminent risk of homelessness in our county can call one toll-free number to be screened for both eligibility and then assessed for appropriate services from there. So when someone calls our call center, they are first screened for eligibility, which includes the call center specialist asking questions about current or last known residency status, and then really getting into a lot of questions related to their current housing situation. Are they fleeing domestic violence? Are they currently street homeless or otherwise in a place not meant for human habitation? The call center specialists do follow a script to assess their current housing situation and their eligibility. If the caller does report that they are fleeing domestic violence, they are offered domestic violence hotline services, and we also ask questions to really try to find people that are experiencing homelessness as defined by HUD Category 1, and those are the people who are immediately prioritized for our services. Our call center operates Monday through Friday from 8 a.m. to 8 p.m. and, as I mentioned, is one toll-free number. So once eligibility is determined through our coordinated entry call center system, really meaning that it is determined that their last known residency status is within our county, and that that person's housing status is that they are literally homeless, fleeing domestic violence, or imminently at risk of homelessness, then they receive a full Your Way Home referral assessment by the call center specialist. And this full assessment and all of their demographic information with the caller's consent is then entered into a countywide HMIS system. And the assessment that they receive is the Vulnerability Index Service Prioritization Decision Assistance Tool, or the VI-SPDAT. This assessment does take about 20 minutes with the caller and the call center specialist. The call center specialist enters all of this information, the VI-SPDAT score, their demographic information, how the caller can be reached or where they can be found, in a summary case note, and refers them through HMIS to the appropriate services. The chart on the left side of the screen does show this flow of services, which you can see kind of funnels into an emergency response system and immediate housing services. And I plan to go more into detail with coordinated entry and how this flow of systems and prioritization for these services work. So anyone, as I mentioned, anyone reporting to our coordinated entry call center that is calling reporting literal homelessness is immediately referred to the Your Way Home Street Outreach Service. And the Your Way Home Street Outreach Service is responsible for engaging with and verifying those Category 1 literal homeless for all callers reporting such. So for example, if a caller is stating that they will sleep on the street that night, they are assessed and they are referred to our street outreach team for a crisis response. Our street outreach helps manage this crisis and problem solve, offers referrals to diversion services if the household does not enter into street homelessness. But our Your Way Home Street Outreach primary responsibility and case management services are for households who are verified as literally homeless. We do verification, as we have found through our HMIS in previous years, including 2016, that only a small minority of people reporting literal homelessness to the call center actually are. So in 2016, it was 22% of people reporting literal homelessness to the call center were verified as such through our street outreach service, which did equal 153 families and 325 single adults. Once street outreach does verify that the caller is indeed homelessness, they continue to meet with that household and engage with them until that household is properly connected to another service, such as emergency shelter or a housing program like rapid rehousing. So street outreach keeps in contact at least weekly, but often daily, helping them to manage their homelessness safely until that appropriate handoff is made. They help them get food, mobile mental health services, blankets, pillows. So average length of time with street outreach can be anywhere from 1 day when they are immediately connected to a housing service, and we do have street outreach also continuously engage with a few people who remain engaged with street outreach for a few months, and these are people who tend to refuse any sort of housing services, either rapid rehousing or emergency shelter. But most often street outreach keeps in contact and engages with them for about 1 to 3 weeks until they are referred, until the warm handoff is made to another program or service. So as I mentioned before, anyone calling our coordinated entry system who is not reporting literal homelessness but is telling the call center that they need emergency shelter are referred to the community queue in our HMIS system. So these for us are households who are doubled up and at risk of homelessness. So again, they call into the call center, they receive that full assessment and are then referred to the community queue. They receive our housing counseling, which is our diversion service. And Your Way Home has really found that because diversion is offered through a coordinated entry system, we are extremely successful with our diversion rates. In 2016, 73% of people who received our diversion services were able to be diverted from utilizing the homelessness system, and were able to self-resolve or, with the help of a housing counselor, come up with alternative housing solutions. And of those 73% that we did successfully divert, we found that only 7% later entered emergency shelter. So we're very pleased with our diversion response, and it is primarily, the success of it is primarily due to the fact that people enter that coordinated entry system first. Our community queue also manages prioritization for all other emergency shelter and housing services. So these services are prioritized based on that assessment score or that VI-SPDAT score that they received through the call center. So the community queue also manages anyone waiting to get into shelter. So those are those people engaged with street outreach at that time and waiting to get into some emergency shelter, as well as for rapid rehousing services. So all housing-related services are operated out of the 3 Your Way Home housing resource centers. Their primary role is to provide rapid rehousing for literally homeless households. Housing identification is done through our dedicated housing locators, whose job it is to engage landlords with the Your Way Home system and help our clients find safe, affordable housing and to promote furthering fair housing practices. The housing stability coaches within our housing resource centers do the social work and case management work directly with households in shelter or on the street by connecting that household to supports that will help the household exit homelessness quickly, return to a permanent housing destination, and maintain that housing and not return to homelessness. They do that by offering short-term rental assistance through a rapid rehousing model, and the short-term rental assistance is reassessed every 3 months. When not doing rapid rehousing, housing resource center staff also look to the community queue and pick up those diversion cases that I discussed earlier. They also are responsible for anyone in the community queue and going through coordinated entry who are then connected to these housing resource centers. They receive a full SPDAT assessment, not the shortened version of the VI SPDAT that they receive through the call center, but they then do the full SPDAT assessment to help them refer to appropriate support services and refer to appropriate housing services from there. So with any household exiting homelessness to a permanent housing destination, our housing stability coach builds the supports around them to help them maintain that housing. So they look to that full SPDAT score and refer in a coordinated way to permanent supportive housing as appropriate. So these are households with high SPDAT scores, long histories of homelessness, and a documented disability. Other supports that we refer to include financial literacy supports, job training services, and basic household goods once they are rehoused, which those basic household goods such as beds, cleaning supplies, table and chairs are provided by our innovative public-private partnership and philanthropic grants for the Your Way Home Initiative Fund. And I just want to note that it is because of coordinated entry and a coordinated homeless crisis response system that we're able to provide these services to all homeless households across the county and prioritize these resources and these services. And lastly, to talk about how our coordinated entry system works with and collaborates with other systems, it is important to note that with coordinated entry and one call center, we did find that 40% of callers in 2016 call into our call center reporting some sort of housing need, but do not meet our eligibility services. So examples of these are on the left. So these are people who are perhaps behind on rent, but still in their own home, who are, have been in jail for many, many years, and sort of a lost connection to those natural supports and cannot return to their home. People who have been in treatment for long periods of time and feel that they cannot return to their last known housing situation. So it's very important that we engage with other systems such as legal aid, hospitals, justice-related services, faith-based organization to help us as a system tackle these big picture issues related to homelessness and housing instability. And with the benefit of coordinated entry and having HMIS be able to look at the data and the numbers and the amount of need versus the amount of resources available, it really highlights where those areas of need are and how we can collaborate effectively with other systems to address those gaps. And again, as the Your Way Home program manager myself, who oversees the coordinated entry system and the entire system as a whole, I am often responsible for facilitating both individual case collaborations and creating clear Your Way Home policies and procedures that help us work in the community towards these common goals, a common language, and common outcomes as well. So I want to thank everyone and thank Housing Alliance again for inviting me on this webinar, and I am going to turn it back over to Jason.
Kaylee, thank you so much for that presentation. I'm sure there will be some questions for you at the end of all of our presentations. I've had the privilege to be working for over a year, almost 2 years, with the Eastern Pennsylvania Balance of State Continuum of Care, and for anyone listening and viewing the webinar who's part of a Balance of State continuum, you can imagine that the effort that goes into coordinating a single county system is simply magnified by an incredible amount by having to coordinate systems across multiple counties. And in just a moment, Kathy Crablin from Valley Youth House and our Court Entry Committee Chair in the Eastern PA Balance of State will talk about what the Balance of State has been doing over the past couple of years. But I've been asked to take a moment just to say that while we were moving forward with our plan for the Eastern Pennsylvania region, which may also be the case in the Western Pennsylvania region for those of you in that balance of state, or a single county continuum that's still in the planning stages for coordinated entry, we've all been up there in that first box, healthily riding our bicycles towards our goal of launching coordinated entry. And in January of this year, received a notice, the entire nation was issued a notice from the Department of Housing and Urban Development that in point of fact, whatever your community's plan for a timeline to launch coordinated entry was, if it is a HUD-funded continuum of care coordinated entry system, it actually must be operational by January of 2018. So our plans, many of us, our plans are hitting the reality of a significantly new set of challenges and opportunities that must be built into every community's coordinated entry system within about the next 8 months. And that includes mature coordinated entry systems like Your Way Home and fledgling or new coordinated entry systems that may or may not have even rolled out yet. So the link at the bottom of this slide will link you directly to a download of that HUD notice. As someone who's read the notice several times and been working to try to apply it in both of these communities you're hearing from today, I can tell you that these the requirements and recommendations in this HUD notice really will help a community strengthen its coordinated entry system. But they do offer significant challenges to existing policies and practices, even for, again, a robust coordinated entry system, which include the idea that consumers should be able to reach out and talk to someone 24 hours a day. That doesn't mean coordinated entry services have to be operational 24/7, but some sort of live access needs to be available. That the HUD notice requires every system to coordinate access not just to select housing services, but all housing services, including street outreach, prevention, or at least government-funded prevention programs, emergency services, as well as transitional, rapid, and supportive housing programs. And that every community have a prioritization for coordinated entry, and that every community significantly reduce or eliminate any barriers that would screen people out of being connected and referred to the right systems and housing based on perceived barriers. Finally, there are a number of strongly encouraged recommendations that are not required to be in place by January, but are absolutely aligned with the whole goal of coordinated entry, and those include building into your system cultural and linguistic competencies, a system-wide housing-first approach, the diversion strategies we've been talking about, program-level coordinated assessment tools, and take note of how Your Way Home uses the full SPDAT as a coordinated assessment tool at the program level for rapid rehousing and permanent supportive housing, and strong connection to mainstream and community services. So this just adds both a timeline and a layer of complexity to what every community needs to build into its coordinated entry system in the next 8 to 9 months. And so that challenge then kind of leads to, well, how does a massive multi-county region take on the goal of coordinating entry into homeless services? And for that presentation, I am going to turn it over to my colleague, Kathy Crablin. Kathy?
Thanks, Jason. So with this map, you can see the area that comprises the Eastern Pennsylvania Continuum of Care. It involves 33 counties, and you can imagine how daunting the task is of developing and implementing a system that is as effective as what Kaylee described in Montgomery County. Where we began was 2 years ago now with the development of a task force that was representative of the 5 regional homeless advisory boards in the eastern section of the state, and a series of community conversations where we got local input on what the issues were that folks were facing locally, and some ideas of what a coordinated entry system might look like that would be effective in each of our regions. From that, we developed a plan that was into motion a year and a half ago when the Eastern COC Governing Board adopted our proposal, and we are beginning to implement a series of RAB-based pilot projects, beginning with the Lehigh Valley, where we piloted a program that started in January of this year. The pilot projects and the ultimate implementation of coordinated entry is funded through HUD COC grants and with some state and local support through private grants and donations. The system is being guided by a RAB-based coordinated entry committee with technical assistance from Capacity for Change, with Jason working very closely with us as we implement the program. So in this slide, you can see across the top half of the graphic what the consumer experience is going to be through coordinated entry, and that is that through access in coordinated entry, that any family or individual experiencing a housing crisis would call either a toll-free hotline, which is managed by 211, or we have established walk-in sites where the same assessment can be done for an individual experiencing a housing crisis. The assessment is the same no matter if the individual calls 211 or presents at the walk-in site, and that is the VI SPDAT that Kaylee referenced in her presentation. And then through the process of the results of the VI SPDAT, we can assess for the appropriate referral to resolve the housing crisis. Along the bottom of this slide is the outline of operational procedures that support what the consumer experience is. As I said, there is a system-wide toll-free hotline, meaning that anybody who calls from throughout, talking now about just Lehigh Valley, so regardless if they're calling from Lehigh or Northampton counties, they all go into one 211 system, and the specialists do the same assessment as would happen at physical entry sites. The specialists at both the call center and the walk-in sites all enter the assessment information into HMIS, so we've got one central data system where all of this information is stored. The specialists that are conducting the assessment begin with a basic screening set of screening questions that help to determine whether the full VI SPDAT is appropriate given their housing circumstances. And then as a result of that assessment, then we're adding individuals onto a community queue or making referrals directly to appropriate services. So in terms of how we're doing so far in the Lehigh Valley, you can see from this slide that we've conducted 300 assessments so far in the first 3 months of our pilot project. And you can see some indication of the acuity of the need. So we do have 211 operating 24 hours. The hours of service for the folks that can conduct the assessments are from 8 to 5. After those hours, the call is taken by a call center that will take the information and then have a specialist call them back in the morning to conduct the full assessment. I'm moving rapidly here, looking at the clock so that we can take time for questions. So at this point, in the Lehigh Valley, we're building a community queue, which is growing rapidly, and trying to resolve how we're going to actually work that queue and take names off the list and make sure that they are being placed appropriately into services. So from the pilot now, we are trying to develop the system that we can roll out across the full continuum, the full 33-county area. We developed a committee with representation from each of the 5 regional homeless advisory boards, someone from the Department of Community and Economic Development that manages HMIS, We have a representative from the Housing Alliance, which is serving as the fiduciary agent for the HUD funding. We have representation from Diana Myers and Associates, and of course Jason is closely aligned with the effort in facilitating our work. So essentially the role of the committee at this point is to issue an RFP so that we can establish the call-in center operator and the managers of the walk-in sites in each of the 5 regions. We will then develop a task force for each of the regions that will be the local implementers of the system, and it will be the task of the committee to develop the marketing and outreach strategies across the 5 regions. So in terms of our progress to date, March to September, we are establishing the policies for the implementation. So in the Lehigh Valley, we have essentially developed a set of policies and are testing them, and now it is the function of this continuum-wide task force to determine how they will work throughout the 33 counties. The task force will also be issuing the RFPs for the call center and the walk-in sites. We will also be developing the outreach strategies and preparing the application to HUD through the COC process for ongoing and additional coordinated entry funding, and also during this time period helping to establish those coordinated entry advisory teams in each of the RABs. October through December will be time to actually issue the contracts for the call center and the coordinated entry specialists. We will be training the specialists in the use of the VI-SPDAT, HMIS, the policies and procedures, and also will do a soft launch of the process. And then beginning in 2018, we will have the program in place, and we'll use that time then for quality improvement and assessing performance, adding additional funding. So the challenges are significant. The geographic diversity, when we are talking about a single process that will be appropriate and successful across urban, suburban, and rural areas. When we are crossing 33 counties, there's also disparate and potentially divided leadership. It is so much simpler when you're dealing with a single county government and existing partnerships across the county, throughout the county. It's also a great challenge, as Jason referenced, that what we had hoped we would be able to pilot across the region over the course of 2 years, starting with the Lehigh Valley, adding 2 additional RABs 6 months later, and then finally the other 2 RABs in the second year. We're now having to implement the whole process in just this year with a full launch in January. But there are also significant opportunities. Obviously, from Kaylee's information, you can see the value of this cross-system cooperation. It's a much better match to consumer needs. It's a better coordination of resources among the service providers, less duplication. The groundwork that we've already laid in Lehigh and Northampton counties gives us some experience in a cross-county collaboration, so we can build on those successes and knowledge gained. And we're significantly blessed, I would say, with the expertise of Capacity for Change and Jason's experience in implementing similar systems change in Bucks and Montgomery counties, most notably, but also his knowledge of the work of other statewide efforts is informing what we are doing. So for those of you who are just getting involved in coordinated entry, I tried to give some thought about what you might be doing at this point in the process. So among other things, you need to be cognizant of the cross-sector representation. and I've listed the stakeholders that are actually prescribed by HUD to be involved in all of our regional efforts. But in addition to that, we found it very, very helpful in the Lehigh Valley to involve those folks who are most vocal about their criticism of the effort. It's been very, very helpful to us to understand why folks might be reticent to engage in the process. So that has been a significant component of our being able to move forward. We've been very, very lucky to have representation from the philanthropic community, most notably United Way, which gives us additional leverage, some expertise in building funding resources. We've had a really good experience in the Pocono region when, I believe, or might have been Northern Tier, where the press was invited to some of the planning sessions, and that has built some momentum in the local community. I would also suggest that you take a lot of time and give people the opportunity for questions and answers and discussion. This is a major systems change. It's really difficult to get outside of the way we've always done things. So we found in the Lehigh Valley that it's been really helpful and essential, in fact, that we had time to talk about and address some of our concerns. I would also suggest that the data from other communities, like the experience of Your Way Home Montgomery County, is a really strong way to build support, to understand the kind of success that they are experiencing through the coordinated entry system is a real way to advocate for the system in your local area. So that's kind of the update of what we're trying to do across the continuum, and I think at this point we want to give time for questions.
Kathy, thank you so much. So if, I believe if people use the chat function, they can type in their questions, and the three of us will do our best to answer them in a concise way. We have, I think, about 10 minutes for questions, and if for some reason after the presentation you have any sort of follow-up request, I can either try to answer that or connect you with Kaylee or Kathy if that's appropriate. Are there any questions for us? I'm looking at the chat screen.
In addition to, sorry, Jason, and again, thank you, Jason, Kaylee, and Kathy. In addition to typing in your question to the chat box in the lower left-hand corner of your screen, if you'd like to ask your question through your phone, you can press *7 to unmute and ask your question, and then *6 to mute yourself again.
So I see one question/comment from someone in Harrisburg. It's very hard for individuals to get into a homeless shelter, and we have many people that are turned away. What can we do as a community to try to make that change? So I think, I'm sorry, go ahead.
This is Kaylee from Your Way Home. I appreciate that question. I think it is from a program manager perspective, we have addressed the needs of people who cannot yet get into emergency shelter but are experiencing homelessness in two ways, really. The immediate connection to street outreach that I mentioned in my presentation to help them manage their current crisis situation, and the second part being that we created a system to connect to permanent housing resources, primarily rapid rehousing through our housing resource centers, who will work with people, directly from the street or experiencing literal homelessness to get them back into permanent housing destinations.
Thanks, Kaylee. And again, I think this is a good moment to point out that coordinated entry is the first step towards understanding the real needs in the community. It is not going to solve every issue and challenge right away. It's only part of the Fuller systems change that leads to coordinated exit to reduced wait lists to the right amount of services in each region, but it's really important to start there. There are a number of other questions coming in, so I want to make sure we can address them. Can you explain the 24/7 HUD core to entry requirement? I can explain that, and it took me a little while at first to really appreciate what that means. What HUD is asking for is for you to have a solution in your community for the hours that your coordinated entry system is not open. So in both of these presentations, you see that there were hours for talking with the coordinated entry specialist in Your Way Home, for example, 8 a.m. to 8 p.m. Monday through Friday. What HUD is requiring by next January is that every community have a call option so that people calling outside of those hours, whatever those hours might be, can still talk to someone live. Examples might include an agreement with a local hotline that's running 24/7 that may or may not be focused on homelessness, but at least someone to talk to explain to someone in crisis at 3 a.m. on a Saturday, we will be able to connect you with court entry. We can't right now, but in an emergency, here are your options. That's what it means. Other examples might be a partnership with 911 in your community or 211 in your community, so that there's some way for people to talk to someone live. Another question, how are local housing providers going to use the VI SPDAT? Will it be a regional contract, individual contract, COC level? So I might ask Kathy to answer that question.
Sure. For the Lehigh Valley and what we're planning in the balance of the Eastern COC is that the VI SPDAT would only be conducted through 211 and the walk-in sites. So if someone presents at a non-designated site, the individual would be encouraged to call 211 or to go to a walk-in site for that assessment. If the individual that's experiencing the housing crisis isn't able to make the call themselves, then the other provider there might assist in making that phone call. But the intent is that whoever's conducting the VI SPDAT is well trained and that the information is entered immediately into HMIS so that we have a centralized database.
Thank you. And just a quick follow-up question for you, Kathy. In the Lehigh Valley, is rapid rehousing available at this point in time?
Yes.
Another question
Jason.
we have is, yes.
Oh, could you give us some strategies for finding more affordable housing, working together with landlords? We're in Carlisle, where you just were recently, and there is really a critical shortage of affordable housing. So what are some of the strategies, ideas you have for working together with landlords to create more homes?
My strategy is to turn to an expert like Kaylee and let her answer that question.
Through Your Way Home, through its public-private partnership and support from regional foundations, we last year piloted a Landlord Engagement initiative which offered incentives for landlords to work with Your Way Home. So this pilot was found to be very successful. We gained in a very short amount of time, only about 3 months, over 30 new landlords to work with our system. It was through the generous donations of these foundations that allowed us to offer new landlords small monetary incentives for working with Your Way Home clients, as well as letting our housing resource centers have access to a pool of funds for mitigation related to physical damages that exceeded security deposits for these apartments. So we have found that this pilot project was extremely successful and are continuing to build on it in this new operating year. And in addition to that, if you wouldn't have access to those kinds of funds or resources, we'll say it's very important that through our Rapid Rehousing program, we have those dedicated staff people as housing locators who do not tend to have a social work background, but instead are come from, many of our housing locators used to be landlords themselves or just have experience in, the real estate world in their work history. And I like to say that they're bilingual in the way that they can talk with the landlords, talk with them about how the Your Way Home program works, while also being able to act as the mediator between the landlord and our rapid rehousing households, so that they can also help the householders understand their lease and their rights and responsibilities as a tenant as well. So those are the two main strategies we use.
Mm-hmm. Do you have that written up on your website that we could take a look?
We have the Your Way Home Operations Manual on our website, which outlines our landlord engagement strategies. And please feel free to contact me directly, where I can sort of send you just the small summary that I have from the Operations Manual, so you don't have to go searching for it.
Great. Thanks so much.
And I know we're very short on time, if not out, but I do want to clarify that there's another way to look at this question of the lack of affordable housing in a community and what the role of port entry is. If you're thoughtful about your data, and in fact, if to this last hour you've observed that in both Montgomery County and in the Lehigh Valley pilot, that VI SPDAT assessment tool is identifying that the majority of people will succeed with rapid rehousing intervention, which means a short-term subsidy and help locating and moving into affordable rental housing in the community. That data is powerful to indicate the need to create better strategies that find that affordable housing, that build the partnerships with landlords, that seek out philanthropic and donor support to engage and retain those landlords. That's all part of how port entry works especially well with rapid rehousing, but also with diversion, because diversion combined with some very limited philanthropic funding can help make it possible for people to remain out of shelter. So our chair is telling me we can keep going a little longer, and hopefully you'll stick with us because we have a few more questions. But if you are signing off because we're at the scheduled end, I do want to make sure to thank both Kaylee and Kathy, as well as the Housing Alliance, for this time today. So we will keep going for just a few more minutes until we have to close. There was some additional question around a community that has one family shelter that has an existing port entry system in place, and the shelter can take 3 months for someone to enter. And I think that's a comment, not a question, but I imagine what the question is how does coordinated entry help with that? And, again, I think coordinated entry cannot create new resources, but it can create the data, information, and will to understand what resources are missing. And with a diversion strategy, in many communities you see the shelter wait list decrease. Kaylee, did you or Kathy want to comment on that observation?
No, I think that's right. With the data that we need more emergency beds, then we can advocate for additional resources. It's also possible that you might have existing resources that would be converted to what is most needed in your area. I'd also point to the success in Montgomery with the diversion system as another answer to limited shelter beds.
I think my final, there's only one more tiny question. I think that question was in Montgomery County, who did the housing locators work for? Kaylee, do you want to answer that?
The housing locators work out of our 3 housing resource centers, which are 3 nonprofits in our community contracted through us, through this Program Office of Housing and Community Development, to provide rapid rehousing services.
So I think we've answered everyone's questions, but I do want to, and I'll ask my colleagues if they have a closing comment. I have one closing, very important comment. I wouldn't take away from this that we're doing this, and we're doing it on this accelerated timeline because HUD requires it. While that's true, what I'd ask you to take away from this hour together is that building successful coordinated entry does mean building a partnership in your community that transcends COC-funded agencies or COC member agencies. What Your Way Home has tried to do is build a identity as a partnership that ends homelessness, and some of its members are COC providers and some are COC individual and organizational partners, but not every single funder, community partner, advocate, and service provider in Montgomery County that's part of the coordinated entry defines themselves as part of the COC. So coordinated entry is this great opportunity to bring attention and resources to ending homelessness if you communicate that it is a unified, coordinated way for anyone in the community to end their experience of homelessness, and that there is a role for hospitals, landlords, food banks, homeless service providers, churches, county government, police, first responders, mental health providers, and others to help work towards one system that more effectively ends homelessness. And that's a takeaway. That building that public-private partnership, that feeling of a community-wide effort is what will leverage the resources, and the services that extend beyond what we traditionally think about with homeless systems. Kaylee or Kathy, any final points to share?
Actually, I just wanted to point out that there were a couple questions that I just wanted to make sure that were addressed that I flagged in the comments. In the Lehigh Valley, is rapid rehousing available at this point in time?
I'm glad you brought that up. I was a little quick with Jason's question. We have been successful in, or are in the process of converting several transitional housing program grants to rapid rehousing. So that will take place with the implementation of this latest round of HUD funding. And I think we have a couple of new rapid rehousing projects that were funded through this last round. So those units are being brought on over the next couple of months, will be brought on over the next couple of months.
Great, thank you. And the last one that I see here is, do you have any suggestions on how counties can address the reality of lack of affordable housing and lack of resources to house those who are not in the homeless system in order for diversion prevention to be effective?
Well, I would say, again, it's a combination of the coordinated entry will generate data, more precise data for your community on what exactly are the housing needs. And it will shine, I think, a spotlight on opportunities to address the lack of affordable housing. At the same time, coordinated entry is just one piece of the puzzle of creating the right mix of affordable housing and supportive services in every community to achieve a functional zero in which the community's resources, including affordable housing, exceed the demand at any given moment for people that are experiencing or at imminent risk for homelessness. So if coordinated entry is the strategy or the conversation that brings new people together, including landlords, property managers, housing developers, and funding partners, then that's the opportunity to maybe take a dent at the huge challenge of affordable housing. In Montgomery County, as part of Your Way Home, the county more and more new housing initiatives, housing development initiatives, are connected with the Your Way Home coordinated entry system by, in some cases, creating units that are dedicated for Your Way Home consumers coming out of homelessness. So there are opportunities around the country to better connect. In some cases, coordinated entry is used to prioritize and refer people for housing choice vouchers and other permanent subsidized housing opportunities. So the opportunities are somewhat limitless, but court entry in itself is just one piece of the puzzle in moving a community towards a complete functional zero for homelessness. Kaylee, did you have any final comments?
I do not at this time, other than to thank everyone again.
Great. Well, thank you, everyone. Appreciate your time today.
Thank you.
Thank you, everyone, everyone that has presented and participated in today's webinar. This is going to conclude the webinar, and thank you all. Have a great weekend.